Hi there, everybody. I'm Lauren Bell. I'm a cognitive behavioural therapist, and some of you may know me as the Yorkshire therapist. So the purpose of this video today is basically just to introduce you all to the role of what we call a psychological wellbeing practitioner. So I was lucky enough to go into York University last week and talk to some of the psychology graduates there about this role and how it is often a perfect opportunity for people graduating from university with a psychology degree. So this little recording here is going to be me sharing the presentation I did at York University last week, just to give you all a bit of an idea and an overview of what a psychological wellbeing practitioner is, and just helping you to understand whether maybe this is something that might be useful to you when considering future roles. So I'm going to share my screen now and talk you through my presentation. So you're probably going to be between 15 and 20 minutes. So we'll just start off really with a little bit about me and who I am. So like I said, I'm Lauren Bell, and I'm a psychology and criminology graduate. So I actually graduated from the University of Teesside in 2008, and luckily, not long after graduating, I myself was able to secure what we call a trainee psychological wellbeing practitioner role. So back in 2008, this was actually a relatively new role. So it was part of what we call the Improving Access to Psychological Therapies team, which was a new government initiative which was started back in 2008, which was all about helping people to access mental health services and get the appropriate level of care that they needed. So I left university in 2008, and thanks to my amazing mum, stumbled across the role of a trainee psychological wellbeing practitioner. And basically, it's been a springboard for me for the rest of my career. So kind of the rest after that is history. So after becoming a psychological wellbeing practitioner in 2008, I did that for 4 years up until 2012. And in 2012, I then was lucky enough again to secure a role as a trainee cognitive behavioural therapist. That was in the Oldham psychological therapies team. And it was actually studying on the course that I later now have become, have again been lucky enough to secure a job teaching on. So it was on the Greater Manchester Psychological Therapies Training Centre course that I did my training on. And so I've been trained, qualified as a CBT therapist since 2013 now. And since 2013, I've also then started to work in private practice. So the Yorkshire Therapist is my private practice. And within the Yorkshire Therapist, I practice CBT. But I also practice clinical supervision. So that is where I supervise other clinicians in training roles and also in qualified positions. I am also qualified in something called EMDR, which is eye movement desensitization reprocessing, which is a fantastic therapy for things like trauma and phobias. And a couple of years ago, back in 2021, I gained my position as a lecturer on the Greater Manchester Psychological Therapist Training course. And so for the last couple of years, I've been helping to train trainee therapists to give them an idea, or not to give them an idea, to give them a qualification in CBT so they can kind of go ahead in their own CBT career. So I suppose the point of me telling you that is, as you can see from that there, a psychological wellbeing practitioner role was the role that got me into my career in the first place. And like I say, it was the springboard for me for the rest of my career here on out. So just a bit of an overview of what this presentation is going to look at. So I'm going to first of all explain what the role of a psychological wellbeing practitioner, or PWP, as it's often easier to kind of call it. So I'm going to explain what that role is. We're going to have a quick look at what a day in the life of a PWP is likely to be like. I'll give you a brief gist of PWP therapy interventions. We'll talk about the benefits of the job. We'll look at what your career trajectory could be like. And obviously then if there's anything kind of further that you want to ask me, you can kind of contact me on social media or via email and ask me any further questions. So what is a psychological wellbeing practitioner? So for those of you who don't know, a psychological wellbeing practitioner is basically a therapist within their own right, and they deliver what we call low intensity psychological interventions in NHS talking therapies services. And these are the services that used to be referred to as IAPT services. So PWPs are normally recruited on a 1-year training role, often through the NHS, but there are some private companies doing this training out there now. And so this 1-year training role basically involves you going to a registered university to learn all the skills and techniques that you will need to provide your patients with evidence-based psychological interventions. So it's a really nice kind of transition to from studying as a student full time to then kind of going into the world of work and then going back to uni to study again 1 day a week, whilst also kind of working and learning on the job. So like I just said, it's really ideal for a range of graduates, in particular those with psychology backgrounds. And like I say, it was my kind of route into CBT myself. So PWPs actually work with patients presenting with a range of different problems. These tend to be mild to moderate mental health problems, and they often include things like depression, anxiety disorders. So that can include things like panic attacks, phobias, kind of some levels of worry, things like that. So it's a really varied role where you see people from all walks of life with varying kind of difficulties and conditions. And so PWPs themselves actually deliver evidence-based guided self-help techniques. So it's not a wishy-washy form of therapy. It's actually rooted in CBT. And as a PWP, you will be a therapist within your own right, delivering evidence-based interventions. So these are interventions that really do work and they really do make a difference. And just for those of you thinking in terms of the financial side of things, so PWPs are recruited on an NHS Band 4 initially, so for that first year of training, and then once you're qualified, you then kind of are promoted to an NHS Band 5 when you qualified. I would just say check on the NHS Agenda for Change website in terms of what those starting pay scales are like, because I can't tell you off the top of my head exactly what those kind of pay scales look like at the minute. So the PWP role basically sits within what we call the NICE stepped care model. So the stepped care model is a model of care that is basically, as it says here, aimed at giving patients the most effective but least intensive therapeutic intervention first. So it's based on the idea that people recover better if we give them the appropriate dose of therapy. So rather than kind of loading them with really intensive therapy straight away, if they're actually at a point where they can, just have a little bit of intervention and take back control themselves, that is actually shown to be better for people. So the step care model is four steps. Step 1 is GP level. So that's where you would go to your GP and they'd maybe kind of prescribe something called watchful waiting, which is where they get you to monitor your symptoms for a few weeks, and then maybe prescribe things like medications and things like that. Step 2 is then PWP intervention. So PWPs look to treat mild to moderate presentations, and it's using things like guided self-help techniques, so techniques that you can learn yourself as a person. And within the PWP role, they often signpost to other services as well. So say if people present with mental health problems, but they've also got secondary issues with kind of finances or, some social issues, PWPs will provide therapy interventions and also signpost to relevant services like that. Step 3 is then where things like cognitive behavioural therapy, counselling, EMDR, interpersonal therapy, where those kinds of interventions sit. And often what will happen is if somebody has tried PWP interventions first and they've not quite been effective, a patient will then be stepped up to the next level to something like CBT or counselling. And then step 4 of the step care model is basically kind of the more severe and enduring services. So that's maybe things like secondary care mental health or community mental health teams, things like that. So as you can see, PWP's role is really valuable, and it's a key part of this NHS stepped care model. So what does a day in the life of a PWP look like? So it's a mixed bag. So you will see a mix of patients with varying problems, like we were talking about a minute ago. And what I used to like as a PWP is that no day would ever be the same. So you'd see some people with depression, some people with panic attacks, some people with phobias. You'd do some worry work with other people. So it was a real kind of mixed, varied bag, and that kind of really kept things kind of interesting for you. It's quite a fast-paced, intense role, but that's not necessarily a bad thing. But within a normal PWP day, you will often see 10 contacts a day. So that's 10 people a day, and you'll normally work about 7.5 hours. But the reason why you can see 10 people a day is because the slots that you offer to people, or the therapeutic kind of time you offer, is normally 30 minutes. So it's not a big kind of hour-long session where you're really kind of getting into the nitty-gritty of things. It's quite a brief kind of contact, because your aim as a PWP is helping people to self-manage their problems. So it's very much, you're giving them a helping hand, but really helping them to remain autonomous in their lives and their recovery. Within these kind of 30-minute slots as well, you often will do a mix of what we call triage, assessment, and treatment sessions. So triage is the very first kind of contact that a patient would have with a service. So where they kind of ring up and they're triaged just to make sure that they're suitable for the service that you're working in. You will then be given your own caseload of patients, and of those patients, you will then be given the task to assess them, to understand what the problem is, so you can decide on a treatment plan and intervention. And then once you've assessed these people, obviously then you would then be delivering therapeutic interventions in these treatment sessions. So you are also in your working day giving admin slots to write up notes and plan further sessions. And you're often very autonomous in terms of how you manage your diary. So you can kind of plan admin slots in between each patient, or you can do a block of patients and then have some admin and then another block of patients again. So sessions now in services tend to be provided in like a blended way. So there will be some pure telephone appointments, some people who do video calls, and then also a mix of face-to-face work, and then group sessions which are delivered, maybe in community sessions to a group of people. Often patients at PWP level are given 6 to 8 sessions, which tends to be plenty, for you to teach them a range of varying techniques. And as well as the patient kind of contact that you will have, which is kind of the big bulk of your kind of day, you will also be offered as well what we call weekly supervision, where you check in with your own supervisor to check that you're delivering interventions correctly, and they're there to support you and provide guidance if you're feeling a little bit stuck. And you'll also attend things like monthly team meetings where you get together with the wider team and you kind of discuss things, and you're all there to kind of provide each other with support. And then finally, you're often offered lots of what we call CPD, so continued professional development. So you're really supported within the role to continue your professional learning, to make sure that your kind of knowledge and understanding is tip top. So here are some examples of PWP interventions. So the first one, which is kind of like the crux of all therapy really in PWP work, is what we call the 5 areas formulation. So you can see an image of a 5 areas formulation here on the right. So a 5 areas formulation is how we help our patients to understand why they might be feeling like they're feeling. So it helps them to understand situations which trigger them and make them feel worse. And then when they are feeling triggered, how that has an impact on how they think, how they feel, how they behave, and different body sensations that they might be experiencing. So the whole kind of idea of CBT and PWP work is that we often, when we're struggling with our mental health, will get stuck in vicious cycles, and our thoughts, feelings and behaviours interact with each other and can create and maintain problems. So your first kind of aim as a PWP really is to help people to understand these cycles, to give them that kind of knowledge and give them that understanding, so they know exactly how they can help themselves and what things they can do to maybe make themselves feel better. So once you've got this foundation understanding with the 5 areas formulation, you will then be offering them some different kind of therapeutic interventions. So these are just some examples of things that you might do. So we have, first and foremost, behavioural activation for depression. So if you look at that 5 areas model again, behavioural activation sits in that little behaviours pocket right there. So the whole idea is that when people are depressed, there is a real significant link between feeling depressed and what we do. So we often find that when people are depressed, they will do less, but the less they do, the worse they feel. So behavioural activation is about establishing how that link is working for your patient and then teaching them ways of managing and improving mood by changing what they do. So it's all about kind of, don't wait to feel better, do something to help yourself feel better. The other intervention is what we call exposure therapy, and that is something that we use for phobias. So exposure therapy is, again, it kind of works on, the behavior bit of that cycle, but also on the emotion side of it. And it's basically about helping your patients to desensitize themselves from a phobic object by exposing them themselves to it in a graded and manageable way. So it's a really, really effective treatment for phobias, and it absolutely works a treat. I actually did it to myself for spider phobia, so I can vouch for that. We've then also got something called thought challenging, which is excellent for negative thoughts, and that works on that thought box that you can see at the top there. And so this is all about helping people to understand the way that they are thinking about something and the way that they're appraising it, and then teaching them to think about it in a way that considers fact and evidence rather than kind of emotions, which might not always be as accurate. And so thought challenging is a really universal technique that can be used for all sorts, and it's an absolutely, incredible string to a person's bow if you can teach them that. We've also got something called worry time for excessive worry, which works on the thought and emotion kind of boxes. So teaching the brain to postpone worry. So it's a little bit like brain training, but it can really help the brain to disengage from worry as a strategy, which tends to be really helpful. And then last of all, they're just a snapshot. There's loads of other things that you will learn to do as well. But kind of finally, the other kind of string to the PWP bow is this signposting to relevant services. So like I say, if you're working with somebody who's struggling financially, or I don't know, needs some support in terms of getting into education or something like that, you would signpost to relevant services just to help them, to boost themselves in that way as well. So this next slide just looks at an example of what a session might look like for you as a PWP day to day. So PWP and CBT work is very, very similar in the fact that it's highly structured. So like I said at the start of the presentation, it's not wishy-washy, it's structured, and there is always kind of a point and a purpose to each session, which for someone like me, I like that because I like being structured and having a plan. But as you can see here, so normally what you do when your patient walks in is you'd be setting an agenda for that session straight away. So saying, right, I think, what we need to do is we'll review the week, and then we're going to review this and then do this intervention today. So like I say, you'd probably start a session by reviewing the week. You'd then do what we call the minimum data set, which is a big thing within kind of NHS services. So these are questionnaires that measure for things like depression and anxiety. So it's a really nice way of us monitoring kind of recovery, because often you will find high scores when people come in, and then over the course of the time people spend with you, we'd be hoping that we see a reduction in that minimum data set, which then signifies an improvement in mental health and well-being overall. Once you've done those questionnaires, you'll then review any homework that you set from the previous session, see what they've learned from it, see if there's anything you can do to build on it. You'll then introduce a new technique or techniques depending on how much time you've got. You then often set that for homework, and then the final thing you'll do is schedule a review, normally for a week or two's time. So like I say, it's quite brief, but quite structured, but there's a point to everything. And as long as you're kind of delivering those interventions in a way that's understandable, people often walk out of that session with loads to kind of reflect on and having learned quite a lot. So in terms of benefits of the job, so from my perspective, these are the benefits for you really, and for anyone considering this as a role. So number one, and what I thought was absolutely amazing myself, is after 1 year's training, you are qualified as a therapist in your own right. So I left uni as a graduate in 2008, and by 2009, I was qualified as a therapist, and I was sitting in GP rooms with patients delivering evidence-based interventions. You know, what more could you want as a psychology graduate to be kind of walking out of university and then being sat there with people making a difference so soon? You're also largely autonomous, so I liked this as well. So you're left to kind of manage your own diary and your own patient sessions. It's up to you to plan what interventions you use, and it's up to you to kind of look at how you balance your kind of one-to-one sessions with your admin time. So it's very much about kind of you running your own diary within that role. I also really liked the fact that the interventions we deliver, they're evidence-based. They're based on CBT, so they genuinely do work. So you've got all this backing of science behind you. So again, you're delivering things that are actually genuinely going to make a difference to people's lives. One of the biggest things for me is the therapeutic relationship. So over the years, I mean, I've been a therapist since 2008 now, so how many? Nearly 15 years now, so a long time. And it's the therapeutic relationships for me that are massive, you know, being able to meet people from walks of life, build a strong therapeutic relationship, and, you know, see these people get better. There ain't anything really better than that, to be honest with you. So you get to build these strong therapeutic relationships with people, which are real kind of positive vehicles for change. And I suppose off the back of that as well, there comes the job satisfaction. So seeing people get better and actually, you know, knowing that you've made a difference. I always say it's like that goosebump factor. So when someone walks into your therapy session towards the end of treatment and they say, Lauren, I'm feeling better. Lauren, you've made a difference. Lauren, I've got my life back. And there, honestly, it is priceless, and it gives me goosebumps every time. So you've got that job satisfaction knowing that you're making a difference to people's lives. And then as well, I suppose there's also the positive balance in terms of career-wise as well. So it's an excellent footing for further career progression. You know, you've got senior PWP roles, you can go into CBT, clinical psychology, management within the NHS, teaching, private practice. The possibilities really are endless. You can do additional training in other kind of modalities like EMDR or interpersonal therapy, which bolt on to kind of this really nicely. So it's a really, really nice springboard to a future career in psychological intervention. So this is just an example of a career trajectory. So this is kind of my career really so far. So obviously you leave university as a graduate and hopefully can secure a role as a trainee PWP within the NHS or private companies. So just to be mindful that these roles are often only advertised twice a year. So you have like an autumn intake. So you probably want to be looking on the NHS jobs website, maybe around July, August time. And then you have kind of springtime intake. So again, you want to be looking after Christmas for those trainee roles and getting yourself into one of those posts. So you leave uni, you get yourself a trainee role and you study whilst working for 1 year. You then qualify as a PWP, and that's when you're into the meat of the job, performing assessments, triage, treatment, group work, and you would be expected to do at least 2 years of that really before you can then start to look for something like a trainee cognitive behavioural therapist role. So not forgetting as well that these trainee roles are fully funded by the NHS, so it is free training for you on the job. So if you're lucky enough to get yourself a trainee CBT job, and again they're out in they recruit around August time and springtime, so be looking at those times of years for these roles. But you get yourself a trainee CBT job, and again it's another 1 year of training while studying on the course. It's an intensive year, but really, really rewarding. And then once qualified, again, you're into the meat of the CBT job. So you're providing psychological interventions in step 3 of the step care model. And there's loads of opportunity then to kind of build your practice by doing further qualifications in things that you're interested in. So EMDR or mindfulness or acceptance and commitment therapy, whatever it may be. So once qualified, the possibilities after that are therefore endless. And I would highly recommend, like I've done, kind of getting into private practice and starting to specialise in the things that you really kind of find interesting and you've got a real passion for. So for those of you who've listened all along, thank you. So just to summarise them. So being a PWP, it's intense, but I would say a hugely rewarding role. It's a real opportunity to make a difference in people's lives. you're actually practicing as an autonomous therapist within 1 year of training. So that's a pretty quick kind of transition from being a graduate to being sat there in a professional kind of therapeutic role. The stuff that you taught to use is evidence-based, so there's loads of science behind it. So it actually really works. And also the teams that you work in as a PWP tend to be brilliant. You know, when I joined my first team at Doncaster IAPT, I loved it. I remember texting my mum on my first day being like, this is amazing. I love it, because the team was excellent and it was just such a nice kind of rewarding, supportive environment. And as well, I suppose finally, it's just an excellent footing for further career progression. So if you're wanting to further your kind of psychological career, I think this is a really nice way in, because I speak to a lot of graduates who are saying it's that real difficulty between I need experience, but I can't get a job to get experience. So how the hell do I get experience to make myself kind of suitable for maybe an assistant role or something like that? So this is a really nice way that you're not necessarily, you don't need to have loads of experience because you're recruited as a trainee, and that's about building that experience there. So thank you so much for everyone who has listened. I know it's been quite a long presentation. But I really appreciate you sticking around. If you've got any questions for me, I know obviously this is not live, so please do contact me via any of these forms. If there's anything further you want to ask me about this job, or just anything else in general about kind of CBT or therapy. So you can email me, you can visit my website, and of course kind of follow me on social media, and I'll be more than happy to help you or answer any questions that I can do about this role. So once again, thank you so much. If you found this helpful, please drop me a message or leave me a comment in here anyway, because it's hard to know how helpful this would be, but I wanted to share it just to see if it was. So thanks again, and yeah, here if you want to ask any further questions. So thank you so much, and goodbye.